Hi, my name is Tessa. I'm a second-year medical student here at the U. I am also one of the student directors for Rose Park Clinic. I'm the director of student and patient services. And I'm really excited to share a perspective on research into student-led clinics with you today. So first, let's dive a little bit into the background. So in 1967, let me double check the name. I think it's the Student Health Action Coalition, which is affiliated with UNC, was opened as the nation's first student-led clinic. Now there's over 200 student-led clinics, but notably this number was obtained from a paper in 2014, where they did a survey, and so there's serious need for updating that number. The Society of Student-Run Free Clinics suggests that the number may be closer to 400 now. So a really, really broad range of growth since 2014. 75% of medical schools have student-led clinics, and 72% of medical students have participated in student-led clinics. This is a number from the AAMC graduation questionnaire in 2021. And then here's just a great picture of some of our Rose Park students and our medical director here at Rose Park. So as I said, 75% of medical schools are affiliated with at least one student-led clinic. We are lucky enough to be affiliated with 5. So I just wanted to capture a little bit of how our 5 clinics capture a good portion of the Salt Lake City metropolitan area and outside cities. We have a really, really great team of clinics here. So diving into the strengths and weaknesses of student-led clinics, and Smith et al. In their paper found that some of the strengths of student-led clinics were serving the underserved in student education, and some of the weaknesses were faculty staffing and funding. Another weakness that has been suggested as well is continuity of leadership in student-led clinics. So now let's think about how we can create opportunities and ask the right questions by looking into the research that's been done on student-led clinics. This is obviously a really, really broad field of literature. So I've done my best to kind of synthesize this today. I found that this paper by Rupert et al. Captured this really well. They looked at the literature pertaining to student-led clinics and their impact, and they've tried to make an argument that more research should be put towards student-led clinics in undergraduate medical education. They examined 20 years of literature into this topic, and they looked at the impact of student-led clinics with regards to 3 roles, as advocacy organizations, as components of medical education, and as medical care providers. And I found that that kind of framework of looking at the research pertaining to student-led clinics is a really, really good way of breaking it down. And so we're going to look at it through advocacy, care, and education today. So diving into advocacy first, here are just a few of the topics that have been looked into in terms of research pertaining to advocacy in student-led clinics. I would also say too that just walking around our posters today, we actually kind of have a really good sample of research that's been done in student-led clinics. There's, for example, a specialty care for the underserved. We have an ophthalmology research paper presentation that was done today. Access and cost barriers by insurance status. We didn't necessarily have one that I see there, but we did have a good presentation by Midvale where they were talking about prescription drugs for patients, which is excellent. Student-led clinics, that people have also looked at specialty selection, advocacy, interprofessional health education. So there's a lot of topics that will hopefully get you thinking about the questions that you might want to ask if you're looking into doing more research and contributing to the field of research in student-led clinics. So now just looking at a selected paper from the field of advocacy, I thought this paper by Suresh et al. Was kind of a good example of research into advocacy because it talked about the attitudes that students develop after working with medically underserved communities. I think that this is a really important thing to think about because student perception of the importance of working in medically underserved communities is really crucial to advocacy in the future. So this was done by the Giesel School of Medicine at Dartmouth. They had 15 volunteer MS1 participants, and they had an 8-month curriculum with classroom didactics and community partnerships. Part of it was virtual, part of it was in person, and so that's kind of an interesting aspect that we could talk more about if anybody is interested. They administered a medical student attitudes toward the underserved questionnaire at the beginning and the end of the program, and they found sustained positive attitudes towards underserved populations. I will note that their findings and the difference between their control group and between the beginning and the end of the curriculum were not statistically significant, so I found that that was a really good point to make about an opportunity for more research here. but the kind of preliminary research that has been done in this field is really promising. And I will say that advocacy specifically is a field within this kind of broader scope of student-led clinic research that's definitely needing a lot more looking into, which it was definitely well demonstrated by Krishna's amazing presentation. So diving into care, here's a small selection of the topics that have been described in the literature. So strategies for clinic expansion, again, drug costs, which we've had here, HIV screening. And I thought another good thing that we demonstrated here was this specialty care. I think I already mentioned ophthalmology. I don't think we had any others, but in the research, there have been gynecological care done at student-led clinics, prenatal care, preventive care quality. People looked at diabetic and cardiovascular care at the student-led clinic. And then just looking over general patient satisfaction outcomes is definitely a big thing that shows up in a lot of the papers. So yeah, so just again, thinking about all these topics that other people have been looking at and what questions we might be able to ask. Here's a selected paper within the field of care. This one is actually from our friends at Shade Tree Clinic, who we were lucky enough to have with us today. And I thought this was a really good paper because it provides oh wait, hold on, I completely lost my spot. Here we go. So I thought this was a really good paper because they kind of got to look at the impact that medical students can make in patient outcomes. And diving into the paper a little bit, they did a retrospective review of 45 medical records of their type 2 diabetes patients, and they looked at the change in hemoglobin A1C values relative to the number of clinical touch points. These are interactions with medical students. And they found that the A1C values improved significantly, statistically significantly, from 9.6 to 7.9. So a really, really great improvement there. They also found a trend that, while not statistically evident, suggested increased number of touch points improves hemoglobin A1C values. The reason this stuck out to me is that I think it's a really good example of how student-led clinics and care by medical students in student-led clinics can be just as good, if not better, than the care that you receive elsewhere, especially if we do it right, and especially if we ask the right research questions to try to improve the care that we offer. Diving into a few education topics. So these topics here, that's kind of broad again. Education is, I would say, within the literature, perhaps the most difficult to capture, the learning outcomes, for example, but also one of the most popular ones to look at. So people have looked at peer mentoring was definitely a big one. Musculoskeletal education was another great example of looking at a specialty, but specifically with regards to education within that specialty at a student-led clinic. How it influences student attitudes and readiness going into clinical rotation. That's definitely a big one for us, considering student-led clinics are, sorry, I think I took the mic away from my mouth for a second, but that student-led clinics are directly integrated into our curriculum. So making sure that our students are prepared for clinical rotation is pretty essential to the U at least, and hopefully to other medical schools as we move forward in this field. So a selected paper from the education side of things. I picked this review. I think it provides a good overview of the current evidence for improved learning outcomes in student-led clinics, as well as a basis for the comparison of study designs and recommendations for improved learning outcome evaluation. That was a really big part of it. So they did a broad literature review. They used a mixed methods appraisal tool to assess the study quality. And notably, their main kind of findings within all of these papers, the clinical skills was the most common learning outcome reported, followed by interprofessional skills and empathy and compassion for patients, as well as more leadership opportunities for students and better leadership development. They did note that within these studies, there was really broad need for improvement in study design. They identified that with the mixed methods appraisal tool. As I said, education and learning outcomes are really difficult to capture, and that's something that I really love to talk about in our discussion today. Table 15, since Krishna shouted out hers. But anyway, so yeah, these study designs, they made a few recommendations in this paper. They said that data collection needs to be a little bit more careful. The design of the study could be a little bit more strategic and better capture the outcomes that you're wanting to look at. They could provide better details if you're hoping to write a paper about a student-led clinic. You could provide better details on the operations of your specific student-led clinic so that readers of the papers can figure out if that specific paper is applicable to them and to their clinic. You can also provide details about the intervention, specifically about interventions that are more longitudinal, because a lot of the time with these papers, it's a very short period of time and you don't really see if the learning outcome is actually one that you're going to see long term. And so in short, I really appreciated this paper because it talked about all of these findings that we really want to capture. Those learning outcomes, interprofessional skills, empathy, and compassion, those are the impacts that we're really trying to make with our student-led clinics and with our curriculum. And I think it really captured the whole scope of the curriculum well, even kind of this whole scope of this breakdown that I had with advocacy, care, and education. That's all kind of representative within this paper and within its findings. So to summarize, as we've all become acutely aware through this curriculum journey, student-led clinics come with strengths and challenges, but they also offer a lot of unique opportunities in the realm of community advocacy, patient care, education. I'm really driving that point home. My hope is that this brief perspective on the research will get us thinking about questions for the discussion, table 15, and not only to improve our own clinics and our curriculum, but also to contribute to the broader literature as it applies to student-led clinics, so that we can enter this in a really research-based way and become a player in this field. These are my references if anybody was interested. There's a lot of them. You may have to look at it after the fact. But thank you so much, and I hope you guys will be at the discussion, helping think of some good ideas.
So we have time for a few questions. The first is from the Zoom chat. Is there data on how SRHCs influence specialty choice, more or less primary care?
So there are a few papers on that. I didn't look at their findings specifically because that's very broad literature review. But I think there might be a paper in my references. I would look at the literature review from Rupert et al. They will capture that data there. They'll have a reference. Yeah.
Any other questions before we? Let's give another round of applause to Tessa.